5 things to know about meningococcal disease. 1. Cases of meningococcal disease is increasing.
As of late March 2024, health officials in the U.S. have recorded 143 cases of meningococcal disease, 101 of them caused by a strain of the bacteria Neisseria meningitidis known as sequence type 1466. The total number of cases of the disease represents a more than 75% increase over those reported at the same time last year. Almost 1/5 of people with known outcomes died from the disease in 2023, higher than the 11% case fatality rate between 2017 and 2021.
2. What is meningococcal disease?
Meningococcal disease refers to any illness caused by Neisseria meningitidis bacteria. These illnesses are often severe, can be deadly, and include infections of the lining of the brain and spinal cord, meningitis, and bloodstream. Keeping up to date with recommended vaccines is the best protection against meningococcal disease. Risk factors include age, medical conditions, medications, and settings. Children younger than 1 year old, teens and young adults ages 16 through 23 years old, and adults 65 years and older. Medical condition like complement component deficiencies, functional and anatomic asplenia, and HIV infection. Medications like complement inhibitors like eculizumab and ravulizumab. Microbiologists, college students, military recruits, and travelers to the meningitis belt in sub-Saharan Africa.
3. How is it spread?
People spread meningococcal bacteria to other people by sharing respiratory and throat secretions like saliva. Generally, it takes close, for example, coughing or kissing, or lengthy contact to spread these bacteria. Those at increased risk of getting sick include people in the same household, roommates, anyone with direct contact with the patient's oral secretions, like a kissing or sharing a glass. Close contacts should receive antibiotics to help prevent them from getting the disease.
4. What are the symptoms? Most common symptoms include fever, headache, stiff neck. Other symptoms include nausea, vomiting, photophobia, or eyes being more sensitive to light, and altered mental status like confusion. Babies may be slow or inactive, irritable, vomiting, feeding poorly, or have a bulging anterior fontanelle, the soft spot of the skull. When someone has meningococcal septicemia, the bacteria enter the bloodstream and multiply, damaging the walls of the blood vessels. This causes bleeding into the skin and organs. Symptoms may include fever, fatigue, vomiting, cold hands and feet, severe aches or pain in the muscles, joints, chest, or belly, rapid breathing, diarrhea, and in the later stages, a dark purple rash.
5. How is it diagnosed and treated?
Meningococcal disease can be difficult to diagnose because the signs and symptoms are often similar to those of other illnesses. If a doctor suspects meningococcal disease, they will collect samples of blood or cerebrospinal fluid. Antibiotics help reduce the risk of dying. Other treatments include breathing support, medications to treat low blood pressure, surgery to remove dead tissue, and wound care for parts of the body with damaged skin. Even with antibiotic treatment, 10 to 15 in 100 people with meningococcal disease will die. Up to 1 in 5 survivors will have long-term disabilities, like loss of limb, deafness, nervous system problems, and brain damage.
Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.